I'm going to kick us off here for our first webinar in 2025. I'm your host, Dr. Allison Fiducia, and today we're going to be hosting a conversation with Dr. Genesee Herzberg, who is a clinical psychologist who received her doctorate degree from the California Institute of Integral Studies. She co-founded Sage Integrative Health, a holistic psychedelic clinic in the Alchemy Community Therapy Center, a nonprofit sliding scale clinic and internship training program, which is based in the Oakland, Berkeley area, across the bay from San Francisco. They also do lots of programming online and other places that you can learn from her expertise. Today, we're going to be talking about a topic I'm very interested in, which is therapeutic touch and psychedelic therapy. A little bit more about Genesee before we dive in. She is a trainer and supervisor in ketamine and MDMA-assisted psychotherapy and therapy protocols. And she's authored a really cool book. It's called The Integral Psychedelic Therapy. I'm going to be dropping in some more links here as we go so you can find out more about her work and the book. If you've joined us in the past, often we'll have a presentation format, but for this topic today, we thought it would be fun to do a more conversational QA with Genesee. And so if you have questions along the way, you can drop them into the QA box, which is in the bottom bar of your screen. I have a list of questions here if we have time, or if your question isn't on my list, I'm going to try to get to it. And we will record the conversation today, and we'll share the video and extra links with you all through email. And we do also put up the links to the videos on our website, so you can always go and look there. So without further ado, I'm going to get started, and I do welcome you all to chat in the webinar chat feature here. If you want to introduce yourself, say where you're calling in from. I hope everybody's staying warm. I know there's a lot of winter weather happening across the country, and probably also in Sweden. I see we even have people joining from all over the world here. So it's great to have you here. Oh, wow. -25 in Toronto. All right. I think you have us beat here in California. It's still pretty sunny and nice. But I'm sending warm wishes to everybody that's in the midst of these winter storms. So great to have you, Genesee. It's been a minute since I've seen you. So it's a warm welcome here.
Thanks, Ali. Yeah, it's really sweet to be able to join you in this way, to connect with you. And I really love talking about this topic. So I'm looking forward to our conversation.
That's great. That's great. We can learn so much just from sharing what we know and what we don't know. Okay, so I'm going to just kind of launch into the questions here. I think it'd be a great place to start with just explaining, like, what are we even talking about when we mention therapeutic touch in this context of psychedelic-assisted therapy?
Yeah, so touch and psychedelic-assisted therapy can look many ways, but at its most basic level, it involves the therapist offering physical contact in some way to the client while they are in a psychedelic-assisted therapy session. And I'll use the term therapist broadly to mean any practitioner that holds space in this work. It's not always a psychotherapist doing that. And there are four basic types of touch as I see it. The first one is called safety touch, and that basically just involves keeping the client safe. So whatever is needed to keep the client safe. And this is the only form of touch that we obtain consent in the preparatory phase with the client, but not in the minute. So if, for example, the client is on their way to the bathroom and they trip, you would offer safety touch to help them not fall. Or if it looks like they're falling off the couch or the bed, you might just help them not to do that. But other than that, we're always getting a consent both in the prep phase and also in the moment before we touch someone. The other forms of touch involve supportive touch, which can look like putting a hand on the shoulder or on the forehead or holding someone's hand, kind of a basic type of thing that you might do with a friend, for example, to help them to move through difficult feelings or feel supported or grounded in the moment. There's also what Stan Grof called focused touch, which involves putting a hand on the body in a place where the client is experiencing tension or a concentration of emotion or some other physical sensation, and it would help to bring their attention to that area and work with it with the support of the touch. And I can talk more about how touch is supportive in a little bit. And then the last type is called resistance touch. And that is sometimes used when someone has a lot of energy moving through them. And it's providing resistance to the client so that they can, for example, push against your hands. This could also happen against a wall or against a pillow, but helping to move energy when it's stuck.
I see. Okay, so we have four main forms of touch, as you've just described. And the next question relates to how do you learn to integrate touch into your practice, and how did this develop within the psychedelic medicine field?
See, so I'll start with how it developed in the field first, because that goes way before me. And it has really been a part of psychedelic healing for centuries in indigenous communities around the world. So it can look a lot of different ways in those settings, in whether it's in an ayahuasca ceremony or working with psilocybin or, ibogaine, really all across the world. But it is everything from, the kind of touch that I just described, more like placing a hand for support or for, help move something. It can involve like in the practice of limpias, which means cleansings at the end of a ceremony. It can help to move energy and clear energy. There are lots of massages sometimes used as well. That's not something that I see as part of therapeutic touch and psychedelic therapy, unless it's a massage therapy who's trained in that kind of work. But yeah, it can look all kinds of different ways, has been used for a long time. And then more recently, in the resurgence of psychedelic work in the Western world, back kind of mid 20th century, Stan Grof and Timothy Leary are two people who wrote about this, though there were many people doing the work that did not write about it, including many women who are often, not, voiced or not profiled and so not seen. But Stan Grof in particular writes a lot about his form of focused body work, which was integrated into his LSD psychotherapy and then later into his holotropic breath work. And that was one of the strong influences for MAPS's MDMA for PTSD methodology, which includes the types of touch that I described in their method. Though with the MAPS methodology, they really encourage people to only offer the types of touch that they are fully trained in. So typically for people that don't have some kind of background in therapeutic touch or body work, that just involves safety touch and supportive touch.
Hmm. Yeah, that makes a lot of sense, and it's a good lead into the next question, which is, how is therapeutic touch and psychedelic therapy different from what you might see in conventional therapy?
Sure. Yeah. And I'll just quickly describe my own background and how I was trained. So I was trained as a MAPS therapist. And so that was further MDMA for PTSD studies. And so that was one of my training influences. I also just want to give a shout out to a modality called relational somatic healing, developed by Shirley DeVere, which has been an incredible support for me in really deepening into how to hold space with this work. And then also my own experiences being in ceremony and receiving touch, which has been for me a really important part of my process throughout. And lastly, through peer practice groups, which I think is so essential. It's one thing to learn how to do this work, and it's another thing to practice it. And I think it's really important to practice it in, with people who are where there's not a power dynamic first. So you can really, and there's a lot of kind of potential for feedback. So you can learn what works and what doesn't, and become more well versed in the subtleties of it before using it with clients. So let's see, can you repeat your next question?
So the question was just, as say like a conventional psychologist training program, would you learn to incorporate therapeutic touch, or is this more specific to psychedelic therapy?
So, yeah, in a typical therapy program, unless it's a somatic focused program, you're not generally going to learn to use touch. And so, for most psychotherapists out there, it's very far from anything they would do in their psychotherapy practice with clients. For somatic therapists, on the other hand, it generally is a part of their training, whether they're, in a somatic therapy graduate program or training in Hakomi or in somatic experiencing. There's a touch component involved. And then there's a big community out here in the Bay Area, the San Francisco Bay Area, of people working with relational somatic healing who are all being trained to do this work without psychedelics. So it can be a perfectly safe and ethical aspect of traditional therapy when someone is well trained. But it's really not a typical aspect of it. And many therapists are scared to, go anywhere near making physical contact with their client because of the potential boundaries and the risk involved, which I think are important things to think about.
Yeah, and contrast to medical professionals like nurses or physicians, where that would be an integral part of the profession to have to touch patients or during different procedures, or as a support if you're a nurse tending to someone bedside. So it's interesting to think about the range of practitioners that are involved with psychedelic assisted therapy, and then if we kind of extend that beyond to guides or facilitators at ayahuasca experiences or things like that. There is a large range of professionals that this topic would apply to, and that may have come from various trainings and backgrounds. So it's great to hear, and I see some people asking this in the chat already about if you want to learn more about somatic work or psychedelic therapy and touch, how would you go about getting trained, or other resources available?
Yeah, yeah. So I'll respond to both those things. First of all, I'm just so glad that you named all the variety of practitioners that end up doing this work. And in nurses, for example, I think are maybe underrepresented or under-respected is their potential to be guides in the field. I know a number of nurses who are just so good at holding space, kind of in general, and then, yeah, have this deep relationship to supportive touch with their clients already. And then at Sage, we actually have body workers and acupuncturists who have become trained in offering ketamine assisted therapy and can hold it with great skill and actually integrate their modalities into it in more of an in-depth way, which some clients have found to be incredibly powerful. So, yeah, there's lots of potential for this work to be expanded in different directions and held by different practitioners. In terms of potential trainings, I think I've actually mentioned most of them already that I would personally recommend. Again, relational somatic healing has been such an important influence for me. Hakomi also offers a touch component, and somatic experiencing does as well. Craniosacral therapy can be a really beautiful adjunct to this work. And then really, I think it's important to have a background in somatic approaches in general. So if you don't have that as part of your training, and this doesn't have to be therapist, there, I think at least somatic experiencing and potentially Hakomi as well, I believe, and relational somatic healing too, offer trainings for people without a psychotherapy license. And maybe another modality that I find to be really helpful, it's not specifically touch related, but it can be, and it's a somatic approach, is called focusing, developed by Eugene Gendlin. And I just find that to be kind of an essential part of the work that I do.
Great. Yeah, lots of good resources. And if anyone in the audience has attended a training that you felt was really great and you would want others to know about it, feel free to drop it there in the chat.
Thanks,
Uh,
Sally. The other thing I'll say about that is, in addition to these other modalities, it is really important to be trained in touch with psychedelics because it is slightly, it's different. We'll talk about some of those differences later, but yeah, you want to get training from people who've done this work with people under the influence of psychedelics. And most psychedelic training programs offer some of this to greater or lesser extent. It is something that we emphasize quite a bit in our training at Sage.
Great, great. Yeah, so we're gonna get into more details too about the psychedelic therapy piece here. Well, I guess we'll just dive right into the next question, which is in regards to how does therapeutic touch specifically enhance trauma resolution or emotional healing during an expanded state of consciousness?
So there are many ways that it can potentially do that. The first thing to note, which is kind of common perspective in the field, is that psychedelics, and pretty much all of them, have a tendency, though this doesn't always happen, to soften our defensive systems or our protectors in such a way that we have greater access to our trauma, to memories, to emotions, and to the ways that we hold trauma in our body. And so touch can be really supportive in helping us to work with those things as they arise, particularly as they manifest in the body. So one of the ways that that happens is by touch. Say, for example, someone is feeling a constriction in their chest. Bringing a hand to that area, whether it's the client's hand or the therapist, can help the client to bring their awareness to that area, which can then support them in delving more deeply into it and gaining both insight, but also emotional expression and sometimes energetic expression, like resting the awareness there. Having touch can help the energy to start to, sometimes it'll amplify at first and then it'll disperse ultimately. So that's one important piece, is supporting emotional release and also energetic release. Let's see. Another piece is just facilitating and deepening a sense of support and safety with the therapist. Feeling held or supported through a hand on the shoulder or holding someone's hand can communicate a certain level of like the therapist is right here, that can be a little bit harder to receive through just verbal communication. So that piece can be really helpful as well. It can also be useful when someone is in an anxious state. This comes up quite a bit as certain psychedelics are coming on, as the effects are starting to appear. Sometimes people feel anxious or ungrounded, their nervous system gets dysregulated, and so supportive touch can help people in regulating and grounding. And then the last piece that I'll mention, though there are many more, is offering a reparative emotional experience. So many of us did not receive the type of love and support and touch, really, that we needed when we were little. Touch is an essential part of psychological and emotional and physical health. I'm sure you've heard of some of the research that happened with young orphans. Believe this was in Eastern Europe a while ago, decades ago, who were, some of them were just given food and touched for purely practical reasons, but nothing else. And they ended up failing to thrive, and some of them even dying as a result. We need touch in order to, as infants, in order to survive and in order to thrive. And some of us may have gotten the basics, but really didn't get to experience what it was like to be held and in a safe person's hands or arms. And so being able to access that in these states, when people sometimes go to really young parts or regressed places, can be incredibly reparative and kind of offer this missing experience that they didn't get.
Yes, it seems very personalized to the individual, their past and the present moment in the psychedelic experience about how touch would be offered or what might feel right to them. And perhaps before we talk more about that topic, perhaps we should go into some of these questions about like, how do you even approach establishing boundaries and ensuring informed ethical consent during and before the therapy practice?
Yeah, this is such an important part of the practice of therapeutic touch in general, and especially in psychedelic work. And it's one that has been underemphasized in the past and is only becoming a really key part of the discussion, I would say, in the past 5 years or so. I'm really glad that the focus is heading that direction. And unfortunately, there have been a handful of violations that really were devastating to hear about and just devastating to know that people were harmed, and also just raised important alarm bells around how the field needs to be holding this differently. So, when it comes to obtaining consent, that needs to happen in a couple of different places, and that includes both the initial preparatory phase and also at the beginning of a medicine session. And then again, whenever someone asks for touch or the therapist considers offering it, they always need to obtain consent and ensure like complete like full consent from the client. So, in that introductory, the preparatory phase, the conversation can sometimes be pretty elaborate, and it involves everything from, doing a little bit of what we did earlier, just letting the client know what touch can look like and how it might be helpful, and then stopping there and asking if this is something they may be interested in. They don't have to commit at this point, but just seeing if they want to go further in the conversation. If they don't, then one thing that it's important to let clients know is that sometimes people are not interested, or say they don't consent to touch in the preparatory phase. And then once they are in the medicine session and under the influence of the medicine, they realize that they want touch. They want you to hold their hand or whatever else. And so I'll let people know that, and we'll have a discussion about what to do. My general policy there is, if you said no in the prep phase, I'm going to respect that, and we can talk about what alternatives might be available in the medicine session, like self-touch or holding a pillow or something like that. And then we'll return to it in the integration and talk about whether we want to adjust our agreements accordingly. If they are interested in considering the possibility of touch, again, this isn't saying yes for sure in any way, just saying let's keep exploring, then I'll want to hear about people's relationship to touch, their history with touch, including, any violations around touch, which unfortunately many of us have experienced. And so to know what their areas of sensitivity might be and what might come up, what might trigger them, and also their cultural influences around touch. Cultures relate to touch in such different ways. And so to know what they're coming in with, and, also knowing what we're coming in with, and how best to relate to them based on all of those things. And then we'll start talking about what they might be interested in. Are there types of touch that they're open to, or that they want to explore, or that um, maybe they're not saying yes now, but they're saying maybe let's see how it goes. And at that point, we'll start talking about what consent actually looks like how to ask for it. First of all, are they gonna be the ones asking for it? Would they like us to offer it? What feels most comfortable for them there? And then also dropping into their comfort level with saying both yes and no. A lot of us just are not super connected to our no's, to what we want and also to what we don't want. And if we are connected to it, we may still have a difficulty expressing it for fear of hurting the other person or something like that, really out of a desire to take care of the other person. And we really don't want that here. Our goal here is that we're taking care of them, they're not taking care of us. And so there are ways to start to think about, are you comfortable with asking for touch? Are you comfortable with declining it if I offer it? And are you comfortable with ending it? And if there's any hesitation there, then we explore. It just opens up a lot for people around, you know, their history around saying no. And then that we can also start to practice asking and saying no and, you know, ending the touch and come up with both verbal and nonverbal cues, you know, in case they, you know, may have a hard time expressing it in certain ways, but, you know, maybe saying like, I'm okay right now, or just like making this hand signal is going to be easier for them. Or with declining it, some people find that just taking my hand off of them is a helpful way to end the touch, or to say, thank you, I'm good now, or you just kind of finding gentle ways. So we just think together about what works for them and come up with a plan based on that. Let's see, there are a couple more things here. One of them is also letting people know, first of all, that you're not going to be offended, you know, whatever they want or don't want, you are there to support them, and them saying no is a gift to you. Them saying no helps you to know how best to support them. And another piece is that you're going to take care of yourself. So you're going to be checking in with your own boundaries and what you're available for, and only being willing, you know, only saying yes to the things that you're really open to. And, you know, it will be a negotiation if they ask for something and you say, you know, I'm not feeling like I can offer that right now, but let's think of some alternatives that can evoke things for people, but it can also open up really important and helpful processes. And then the last piece is emphasize throughout that touch is always going to happen with consent unless it's safety touch. And you'll let people know about that both now and also in the moment. And that touch is never sexual in nature. And so you're going to be really clear about holding boundaries around that to keep them safe.
Great. Yeah, I'm feeling comforted just by the level of conversation that you're describing. If I was a client coming in and to something new like psychedelic therapy, and having the therapist just explain this in such a detailed way would be very comforting, and know of my own autonomy to receive or not. And just one point of clarification, it does seem like this safety aspect is always in place. Everyone has to agree to that level of, if you need a hand off the couch to make it to the restroom, we see you might be falling off the couch or something, then you must agree to that, or how does that work?
I mean, we ask if they consent, and if they don't, then we'll think about what to do there, you know? I mean, we also keeping them from hurting themselves. So, you know, if they're not willing to agree to us keeping them from hurting themselves, for example, I mean, I've never seen that come up, but it is something that we talk about. You know, or you know, the falling piece. Yeah, I've never had someone not be open to safety touch, so I haven't actually had to navigate this, but it's not something that we're going to force on anyone. So yeah, we would just need to think about alternatives in those cases.
Mhm. And if someone isn't, say, open to more therapeutic touch in a session, what type of alternatives are there? I've heard of some use of weighted blankets, or are there other ideas to offer support to someone that may not involve the therapist touching them?
Yeah, weighted blankets and heating pads are really great tools to have on hand. Also, stuffed animals and soft pillows. I have so many clients. I've got a really soft pillow in my office, and so many clients that will just grab it and hug it throughout their session. And, you know, along with offering these more kind of relational forms of holding, another part of our work as therapists is to support people in developing the tools to self-soothe. And so, you know, self-touch can be an incredible resource for that. So whether or not they're open to therapeutic touch from the therapist, that's something that we can practice together, you know, a hand on the heart or on the belly or wherever they're noticing tension coming up. Um, So those are some big ones. Sometimes having little kind of fidgets or like a stone to hold. I've got some crystals in my office, and some people like to hold those. Pushing against the wall or against a pillow. Um, yeah, they're even just like feeling a soft blanket. There are lots and lots of different options, and I'll generally just work with the client to see what comes to mind for them, what feels right, and offer some options.
Yeah, and for anyone here who's not super familiar with psychedelic experiences, the sensory perceptions are enhanced. So that goes for the tactile stimulation as well. So beyond just visual and hearing, we have our sense of touch that can be heightened. And I think there's a lot of research that could be applied to this area. I mean, one for, of course, for how do we keep people safe, informed, um, best to train individuals into delivering this. But beyond that, what's going on in the brain? What's going on in the therapeutic session? How else can we bring in sensory enhancement for aiding the process that the participant may be undergoing?
Yeah, so much potential for research there. And I think it's badly needed. We have a ton of anecdotal evidence at this point. And personally, I think that quantitative research is just as important as qualitative. And I would say that a lot of the kind of over the years, many, many clients and therapists who've reported support in this way offers a good kind of base. But yes, a lot of potential for research. I wanted to name a couple of things that I've seen come out recently, or one personal experience and one thing I've seen come out. So Shirley DeVere, who came up with the relational somatic healing method, also just completed her dissertation on relational touch and psychotherapy. It doesn't include psychedelics, but she interviewed, I think it was 15 participants who had undergone therapeutic touch and regular psychotherapy, and did a qualitative phenomenological analysis of their experiences. And it's just beautiful to see how people describe their experiences and the themes that came out of it. So that could be a great resource to check out. And then on a personal level, I got an Oura ring recently. It's a ring you wear on your finger that tracks your vitals. And one of the most interesting things that I've learned about my experience through that is that when I am in therapeutic touch sessions with clients, I am in a restored state. So my system is incredibly regulated to the point that I'm getting restored through that process. And this also happens for me when I'm on the acupuncture table, for example, or the massage table. So I don't have a client who has a ring as well, but I'd be very curious to see what their experience is. And, as like Dan Siegel talks about, one of the healing components of therapy is co-regulation, or right brain to right brain synchrony, where we're literally regulating each other's nervous systems through the process. So I would guess that if I'm in a very regulated state, that they would be also, at least at some points when they're not, kind of processing their trauma.
Yeah, absolutely. And I'm thinking too about experiences with animals. I've been spending a lot of time with horses, but
Mhm.
also with dogs, that kind of calming effect that people feel just from petting animals, and that relational aspect with the animal, to be able to touch them and interact with them in that way. And there are studies talking about the synchronization of brain activity and heart activity between human to human and between human and animals whenever you kind of drop into a state with them. So I think the science field has a lot to catch up on this, that a lot of us can experience already and intuitively have benefit and find peace and calmness from different forms of touch.
Absolutely.
Yeah. So let's kind of talk a little bit more practically. We have some questions in the chat and also on my list here in regards to what is like the unique interplay between touch and psychedelics compared to psychotherapy? And I think more specifically, like what are some of the practical techniques or frameworks that come up to integrating touch into psychedelic therapy? How might it be presented in the session? At what point would you bring up touch? Those types of questions, maybe you could walk us through an
Yeah.
example.
Yeah. So, in terms of some techniques for integrating touch into the sessions, one of the most important things is to really track if, well, if you're the one offering touch, if the therapist is offering the touch, to really track where is this coming from and who is this for? If you feel an impulse to offer touch, is it because you sense that the client is in like an overwhelmed or fearful state and a supportive hand could be helpful? Or are they in an, just feeling a lot and you want to calm them down? Like if it's you're trying to regulate yourself by regulating them, uh, that's not a good reason to touch. Where if they're like not okay and asking for support, that could be one thing you could offer them. Not the only necessarily. There are lots of ways to help people ground without making physical contact. But if it's something they said they want, if it's something that's worked in the past, that might be good opportunity to offer it. So yeah, really, really checking in with yourself because there's a strong potential for therapists to um, in general, through psychotherapy, to gratify their own needs through the work, and that is, really starting to cross a boundary, and it can look a lot of different ways. So it's more of a spectrum of boundary crossing there, but really we're there in the session for them, not to be meeting our own needs. So people coming in with a strong need for, intimacy or for feeling loved or for feeling idealized or for sexual contact. If you're moving from that place, you really need to be checking yourself. You need to be seeking consultation. You need to be really probably not doing touch work for a while and maybe even pausing from the psychedelic work until you feel like you've really got a handle on those needs and are getting them met elsewhere and are working with them in your own therapy and getting really solid consultation around them. Because that's, I think, where a lot of the violations that have happened came from, is the therapists kind of falling into meeting their own needs rather than the clients in the session. And psychedelic work can really amplify the power dynamic and put the client in a place where they're strongly idealizing the therapist, like, oh my God, this is helping me so much. And it's you who's, making this happen, as opposed to it's, a combination of the medicine and really ultimately the client themselves and their own, inner drive towards healing that's really doing the work there. So, when that idealization starts to happen, it can make the therapist feel really good about themselves and powerful. And it's a tricky dynamic to navigate. And it's really important for the therapist to be developing awareness, if that dynamic comes up and getting consultation around it, like I said. So that aside, if you decide to move forward with a touch, or we'll say if the client asks for it, next step is to check in and see, is this something I'm comfortable offering right now? Because if you're not comfortable, then the client is gonna sense that. And it's not going to feel good for them. If you're straining yourself, if you're straining your body, they're going to sense that and it's not going to be helpful. So, first of all, is this something I'm open to? And then, if it is, really, first of all, grounding into yourself, into your back body, and into the ground, and finding yourself in a place of presence and kind of present moment awareness and openness to the client and what's happening within them. And then getting yourself comfortable into a comfortable position. So in relational somatic healing, we use a lot of pillows. We always have lots of pillows at hand. And, maybe we need one under our arm and another one, under our elbow or whatever it is, just making sure that we can relax our whole body as we're offering touch to the person. Otherwise, it's not going to be sustainable.
You mean like leaning over with the hand over the bed or something is, yeah.
Yeah,
Okay.
your arm gets tired, or like I've had before I learned that methodology, I didn't really have that knowledge, and so I hurt my back a number of times just like leaning too far, and so yeah, it's just a really important thing to think about.
It's a very practical element that I had not contemplated before. Makes a
Totally.
lot of sense. And
Yeah.
just, for non-therapists like myself, like, so what does this look like? I know typically there's a couch and there's chairs. I know you might be sitting across from the client. Would you also go sit on the couch next to the person? Or what are the different arrangements there?
Typically, it looks like the client on either a couch or a bed. So they're lying down at a couch that where they can lie down all the way, and then the therapist is sitting next to them, either in a chair or on. Sometimes I'll sit on a cushion on the ground, kind of depending on, their height and, which couch I'm using and that kind of thing. Some people do work with a client on like a fold out mat on the ground, and so the therapist is sitting next to them. I find that to be hardest on my back, so I don't do that. And then with like very low dose psychedelics or in just regular touch work, the most comfortable position is always going to be the client on a massage table and the therapist on a stool so they can find exactly the right height and position themselves exactly right. But that gets a little more dangerous if, the client is on a higher dose of psychedelic just because of fall risk. Um, yeah.
Yeah. Yeah, and some of these sessions are very long, if it's MDMA or psilocybin, so that's a consideration with the sort of how the room's set up, where you all are sitting.
Yes.
Um, yeah, okay, great. Let me
And
look at
how
the,
long touch, just one more point to add there, and how long touch is offered. Like, some people, in the course of their psychedelic sessions, especially just want to hold your hand the whole time, or like, oh, that's just so nice to have your hand on my heart. Like, just keep it there, And so the therapist really needs to kind of navigate the client's needs with their own and take breaks at time. And the client seeing you taking breaks is going to instill confidence and safety in them. So it's not a problem to do that at all. But just making sure that for yourself it's sustainable.
Yeah, that makes sense. And I know you've worked with ketamine and MDMA and some other substances and, um, or even ones you haven't. Is there an opinion about, is touch more applicable to certain substances, or do clients want it more?
So, what I have, my general guideline would be it actually depends more on the dose than on the medicine. So, lower dose ketamine, lower dose psilocybin, lower dose LSD, and like lower dose 5-MeO DMT, for example, all can be safely used with touch. MDMA in general, can be a great medicine to incorporate touch work with. And largely that has to do with consent, but also the client's ability to really perceive and work with the touch that's being offered and the effects that it has. Where when you get into, high dose ketamine, for example, people are in pretty, dissociated or ego dissolution kind of states where they're not even there with their body. And so I would say often it's not appropriate to touch people in those states. Occasionally, I've experienced once or twice. This is actually more in my kind of peer practice group settings where I've like held someone's hand as they're going into a somewhat higher dose journey, and it not all the, not kind of highest dose, but kind of medium high dose. And it allows people to feel like you're right there with them in a different way. Like they've taken you along for the ride, and that can be really supportive and helpful for some people. But yeah, once you're in a high enough dose, it's more of an internal experience, and touch doesn't really make sense most of the time in those instances.
Mhm. Yeah, and I was just thinking about, there's research and obviously lots of people out there using psychedelics in groups. I imagine touching other people in the group, if you're in a session, wouldn't be appropriate. And are there discussions that you have in group settings, or would I'm not sure if you've done any group therapy work with psychedelics, but I'm just curious about how people might approach those conversations if they are, say, hosting a group of people.
Yeah, yeah. So I've done it in both of all, first of all, personally in group ceremonies, and also I've held groups of trainees in our training programs. And also I've been offering a ketamine, acupuncture, and sound healing group experience, which has been really beautiful. We actually have one coming up on February 1st that I'm excited about. And in all of those settings, the agreement is that participants are not touching each other. It's just the facilitators that offer touch. And we do have conversations about consent prior to moving into that.
Yeah, that seems something to be well aware of if you're hosting groups or participating in a group, to make sure that those guidelines are in place.
Yeah.
So I'm going to ask a question here that came in the chat. It's referring to when approaching focused or resistant touch. Do you practice any hard boundaries around parts of the body to avoid, or other ideas around this form of touch?
Yeah, so when we talk about where clients want touch, I'm always clear that I'm not touching any area that they might perceive as feeling sexual. So, in general, that's the genitals and the breasts. But if there are other places that they feel might evoke those kinds of feelings, then we'll set a limit there. And also, it's also just on a case by case basis, where do people feel comfortable with touch? And where do I feel comfortable with touch? So, and it might vary based on the client and just the dynamic between us. So, with some people only offer certain things versus others. And, I'm making those determinations based on what I know about their histories and also what I'm sensing into about my comfort levels. In terms of resistance touch, that's pretty limited in terms of what that can look like. You're not really pushing on, you're not even really pushing. You're offering the resistance, and it's maybe with their hands. That's the most common place, or their feet could be another place where energy can sometimes move through. Um, yeah, I mean, those are the only two places that I've ever offered it. And I want to make a distinction there because there's been some critiques coming out around therapeutic touch coming from people who are not therapists and don't understand the complexities of touch and how it works or the nuances. But one of the issues that they've raised is that with resistance touch, there's an issue of the therapist holding the client down and also not potentially being able to decipher when the client wants to stop. And when you're practicing resistance touch, there's a really clear guideline that you're only offering resistance when they're pushing against you. So as soon as they stop, you stop. You're not holding the person down. You're not offering unwanted resistance. You're really feeling into the energy coming from them and like offering something for them to push against. So they're unless the therapist is explicitly crossing boundaries in problematic ways, then there are very clear guidelines that would, completely avoid the issue of people being held down without wanting to be.
Right, right. And I mean, underscores too why it's necessary to have training in these particular modalities so you get some practice and you get understanding around the nuances
Yeah.
of how to offer it, how to know how to interact with clients around this type of resistance.
Mhm.
And I also just wanted to mention Dr. Jason Loma has a new article out that is introducing, and it's called the Touch Outcomes Measurement Inventory. And this is to assess client perceptions of touch. This was specifically really related to MDMA therapy. I'll drop it here. I haven't had a chance to take a look at it yet. But that seems valuable to get some feedback from your clients about how it's perceived and
Absolutely.
ways to
Yeah.
improve.
Yeah, we always have conversations. One essential piece of therapeutic touch is having a conversation in the integration sessions to find out how that landed for them and what worked and what didn't. But I really appreciate the work that Jason Loma is doing right now. He also developed a pretty comprehensive protocol, for the sake of some of the research that he was doing that I think is great. And yeah, he's one of the primary people doing research in this area right now. I also want to give a heads up to Emma Knighton, who wrote a chapter in our book actually about consent and touch, and has just come up with a very clear and useful protocol for exploring things like, people's trigger maps and their yeses and nos and that kind of thing.
Great, great. We'll be happy to share that in the email follow-up, where we'll post the video and some of the other links shared here in the chat. I'll go back and grab. We also chatted about maybe sharing like a case example. I don't know if you have anything that comes to mind that you would like to discuss around that topic.
Yeah, yeah. So this came up when I was thinking about like examples of how touch has amplified the therapeutic process and the work that I've done. And there were a couple of cases that came to mind. The first one is an example of a kind of both the ways that touch can deepen the client's sense of relational safety with a therapist and also offer a reparative emotional experience. So this is a client with very significant and complex childhood trauma, sexual abuse, emotional abuse, physical abuse. And that's led to pretty severe symptoms of PTSD and depression and, yeah, a range of other things. And when she came to me, she couldn't, she was having a hard time getting out of bed and functioning. She had to stop her work for the most part, was having a hard time keeping up with, kind of participating in the family, that kind of thing. And through our work together with ketamine-assisted therapy, we included touch in that work. She was very open to it and had a number of experiences as a young child amidst her trauma and afterwards of just not being supported in it, of having no one to go to, of, not being able to talk about it, and of, certainly not being held in a way where she could like express her feelings and, be held physically. And so through our work, we slowly integrated touch in a way that felt safe to her. It was very important to go slow given her history of sexual trauma. And over time, it's what would happen is that her young parts would come up, and we're not talking about parts work or internal family systems here, but that is an important part of the work that I do, and it just comes up so often in psychedelic work, where people regress to younger parts or younger states of consciousness. And so she would have these younger parts come up who uh, couldn't really receive the verbal communication that was happening, or they could on some level, but it wasn't hitting them in the ways that they needed. And we found that therapeutic touch in particular, they were able to receive and internalize. And so we did a number of ketamine sessions. In one of them in particular, I have a memory of her just needing to curl up and be held, like my arms kind of around her back holding her, and she was able to just like fully release into the kind of fullness of the emotional experience that she had and just start sobbing and being held in that experience. And from that point forward, this young part, and we've done a lot of parts work, and she's kind of identified these different parts. So this particular young part who held a lot of her trauma, started to trust me in a way that she hadn't trusted anyone before. And then through that trust in me over time, she's been able to translate that trust to the adult self of the client. And so they've developed this kind of like healthy internal relationship within herself so that, she over time will not need to rely on me in the same way. And then we've also witnessed her being less symptomatic in a variety of ways. And one of the ways that we understand that is that this young part has learned to be able to express her feelings and experiences directly to us, particularly when, touch is in the picture and she's feeling really safe and held, as opposed to acting them out in the client's day-to-day life, which is what would lead to some of the symptoms. Like some of the, by acting them out, I mean like kind of taking over, or in IFS terms, blending in such a way that she just feels totally overcome with sadness and can't get out of bed, or incredibly self-critical, or just, highly codependent and focusing on others for her. Um, to kind of others rather than her own needs. So yeah, I've really seen some profound healing happen, and I think we both would attribute a significant piece of that to the touch that we've worked with in her medicine sessions and outside of them as well.
Yeah, thanks for sharing that. Really elated with me to hear that idea of if you experience trauma or a lack of having your needs met as a child, that um, that's how you get a lot of information or that support as a young person. As you described, the nurturing touch is so essential to our development. So that's very intriguing how that can unfold in a psychotherapeutic process and then lend itself to a more cognitive idea of younger parts, and once those needs are met, how that can be integrated more into the talk therapy aspect as well.
Mhm.
It makes a lot of sense if you think about how we develop our neurodevelopment and
Yeah.
why that would be helpful.
Yeah, it's almost like you're helping these young parts to grow up and to develop in a healthy way after being stunted at the age where the trauma happened for so long.
Yes, absolutely. So I have a question here about, we do share the recording after, and I'll drop the link here. It'll be posted on this page. And if you registered for the webinar, you'll also get an email with some resources and links shared, but you can definitely find it on this page. Give us a day or two. And with that too, I just want to highlight some of the great work that you're doing. You've mentioned some of, I don't know if you want to share more in depth about some of the trainings or other offerings if people would like to find out more. Is your website the best place to send people
Yeah,
to?
great. Thanks, Sally. So
Yeah.
I would say that the Sage website, the Sage Integrative Health website, may be the best place to see kind of the offerings of the clinic, and in particular the event that I mentioned and other events that we offer, and our training program. So we just completed the first round of our, we call it Integral Psychedelic Therapy Training Program. It's in part based on the book and ties in a variety of different modalities, including somatic work and depth psychotherapy and touch work and a decolonizing approach. Um, and it runs about 6 months and is, as opposed to a lot of the other trainings out there, it's less of a speaker series and more following along with some consistent faculty throughout and focused on getting into the nuances and subtleties of the therapeutic approach. So less of a broad overview of the field, though we provide some of that, and a lot more of like, how do you actually do this work? And let's practice doing this work together. And it includes experiential work with ketamine and allows people to finish up with a pretty comprehensive training in ketamine-assisted therapy and readiness to step into that work along with consultation, which we offer too. So our next round of the training will be launching in September, and we're about to update our website with, you can find the information about the last training year on our website now. We're about to update it to information about the next training year. Super excited for it. We keep a small cohort of 40 people, and yeah, I hope some people are interested in joining us. It's both virtual and then the in-person for the experiential. And
Yeah, awesome. You and your team there have so much experience and expertise to share. I highly recommend if you're able to join the training and to learn from these pioneers in the field. Also, I just want to mention if you wanted to take a shorter online course, Kylea Taylor has 3 ethics courses listed on our website. And it's these are necessarily centered around therapeutic touch, but a lot of discussion around awareness and building that in yourself as a guide or a therapist and knowing your own motivations. So just a drop there in the link there dropped in the chat. And is there anything else you wanted to share?
just a last quick thing is that we have several chapters in the book Integral Psychedelic Therapy that are focused on somatic approaches and touch by real leaders in the field in these areas. So Emma Knighton, as I mentioned, also Veronica Gold, who is a fellow MAPS therapist, and also one by Shirley DeVere and her colleague and my dear friend Jackie Hall, that's specifically on the relational approach to touch in psychedelic therapy. So yeah, great book, covers a lot of different topics. I highly recommend.
Excellent. I just dropped it in the chat there. And I just want to give a shout out. Thanks to everybody that came today. It's so fun to host these. And thanks for your patience. I was sick last month, so we had to reschedule till today, which I'm really happy we did because we have all of you here. And I hope you'll join us next month. We'll be releasing the speaker information soon, so just stay tuned to that. And I appreciate you so much, Genesee, and everything you shared, and hope you have a wonderful rest of your day.
Thanks so much, Ali. It's such a delight to be in conversation with you. I really appreciate your questions and your thought-provoking answers. It's, yeah, just really fun to talk to you. So thank you.
Yeah, I learned a lot. Thanks for coming today. All right, take care, everybody.